shared interest in this conversation, as well as the population that we're hoping to hear from in the next one. So the Attorney General will be here any minute. I will pass this around. While I do that, I'm also going to just put up some of our materials in the back, some flyers related to broadband mapping. You might hear about an investigation that our office is running about youth in Colorado, their use and experience with social media and how that impacts their public health. We have a flyer back there that has the QR code that has the survey that we'll talk about. So if that's something that there are teachers or counselors or parents in your life that, or young people that might want to complete that and share their experiences for our investigation, come grab that out back. I feel like that's the best place to put it. But really just thank you for coming. Some resources out back. This is optional, but share your email if you do want to keep in touch with our office about the next time we're in town, or updates in this very broad topic that we're here to discuss today. Carry on. Thank you. I'll be here in a second.
Oh, yeah, me too.
There are certain water rights. No, it's stopping. It's good, but there are certain water rights that
And luckily it cooled down a little bit. It's still hot. No, maybe yesterday.
Yeah, no, I know.
Yeah, right.
Adrian. It's a who's who.
It is now.
Of the lower valley.
It's just in one. We're now complete.
It's very good to see you. I'm good. How are you? Good, good. Thank you. Great. Mr. Birds.
How are you?
Really good.
Adrian.
You get extra points if you can see them. You probably can, yes.
Looking sure?
Give them a name.
Doing good. My only skill set. Thank you for coming.
You are good.
Please do. Virginia, who's here. Right behind you. Needs to meet you. Hi, Jason.
Hi, oh, nice to meet you. I've heard a lot about you.
Good, I hope.
Yeah, all about
I get that a lot, but I always have to. How are you? I stood alone.
Oh, he was there. It is
All right, our guest of honor has finally made it here. I want to thank you all for coming out. My name is Joseph Ayala. For you that don't know, I am the mayor of La Junta. It is a pleasure. It is a pleasure to have Phil with us. We met last year for dinner, and I told him, you got to come down. You have to come down. You have to come down. He was worried about election stuff and all that, and he won, so we're glad he won, but he came through on his promise to come down here. And he's going to have not just this talk, but another talk afterwards, which we mentioned. If you guys want to stay around on ag issues and stuff like that, by all means, please feel free to stay. But he's here for us. He's here to have these conversations that need to be had. We have people from all over southeastern Colorado here today, which is great. We haven't had this many people in attendance since we passed the CAD ordinance. So.
What did the ordinance say?
No, we won't talk about that. So we're really happy to have everyone here. Feel free to ask away. And with that, Mr. Phil Weiser, Attorney General.
Thanks, Joe. Thanks to the great Rick Klein in the back who makes all things happen. A hunk of gold water. We're here to enjoy it. The turnout here is really spectacular. I am so deeply appreciative for all of you who spread the word. I know that started with my great outreach director, Diana Noyes, who's here. Thank you, Diana.
We met.
And we also have your county sheriff, another friend, Sean Mobley, who's on the Peace Officer Standards and Training Board. I would say when you think about how we can do the best we can here in southeastern Colorado, the rule of law and law enforcement and public safety is one critical foundation, kind of one pillar. Another is what I want to talk about in this session, which is so closely related, is behavioral health. I recognize we're at a very difficult time for people's mental health, and I want to spend this session visiting with you all, hopefully coming out with some actionable next steps. And then third, stay for the encore. It's about the agricultural economy here in southeast Colorado. You'll be happy to know I've already purchased some watermelon in Canada to take back with me. I would not be well received if I didn't, because we appreciate what you guys grow here and appreciate the importance of agriculture, and there's a lot to talk about in that session. So let me start on mental health with a few different lenses that I hope can stimulate some conversation. And I want to start with young people because it's the one that hits me closest to home and scares the hell out of me. I've got 2 teenagers. And when you think about when we were growing up, because a lot of people here will get my culture references, it was a different world. A few TV channels, no texting, no social media, and if you were resourceful, maybe you could find marijuana. Now, pills with fentanyl are easy to get access to. Vaping is encouraged on social media, and most kids are on social media where the algorithms that serve up content are designed to keep you engaged, even if that means as a young girl you're looking at body image or how to lose weight, and what you get are self-harm videos and even one suggesting suicide. On top of that, these same technologies make it easier and easier to engage in bullying and other forms of demonization, because outrage and anger drive clicks. So we run Safe to Tell in our office, which gives us a regular glimpse of how are the kids doing. The short answer is the kids are not all right. The number one threat we hear about month after month is about kids making plans for suicide. I was listening to a podcast that had the following statistic, and I'm going to get it slightly wrong, but it'll be close. Girls 13 to 21, 25% of them have made a plan to take their own life. What? Yes. So, and there are other data points that have led the Surgeon General to say this issue around youth mental health is a crisis. So what do we do about youth mental health? I'm going to mention a few points, and I look forward to that conversation. Number one, we've got to figure out how we engage schools in a smart, trauma-informed way that we are able to get a sense of like how a child is doing. Because when someone is close to trauma of different kinds, a family member who is dealing with substance abuse, or someone who has dealt with physical or sexual abuse, or someone who is a law enforcement officer and saw something really upsetting and comes back in a terrible state of mind, all those things kids pick up on. It affects them. So how do we build better awareness. In the San Luis Valley, they've done something in Alamosa, which I'll be happy to chat about if any of your schools are thinking about this. When the police know that something affected a kid in a household, they literally call the school. And they say, I want you to know Johnny had some pretty upsetting thing happen at home, that we showed up a domestic violence call. He'll need probably some awareness tomorrow, some support, because he's probably not going to be in the best state of mind. That type of way a community cares about one another, that type of connection is really powerful. We're also investigating TikTok and Instagram on this issue I mentioned about the algorithms and how social media is harming young people. We have sued Juul, and we have $32 million that we're now going to spend to invest in addressing the vaping crisis and how we support young people. And we're going to keep looking at this question about what do we need to do to support young people at this difficult moment. We're obviously seeing it up close with the Safe to Tell program. We work closely with schools and mental health providers. A second point I need to highlight, because it is also again, hard for us to fully take this on board. It's the extent to which we have a substance abuse crisis worse than, again, anything close to when I was growing up. When I was growing up, people might say, here, take this drink. Now it's take this pill. And the difference is the pill is almost certainly going to have fentanyl in it. You can no longer buy prescription drugs. 15 years ago, people were like, oh, I just bought an oxycodone pill. And it probably was an oxycodone pill through, like, you heard about these pharmacies that they're going out the door. The back door. No, now they're counterfeit pills. And the active ingredient is fentanyl, which is 50 times more powerful than heroin. So you take one of these pills because you think it'll make you feel better, and the chances are really good it could kill you. So we're working on a campaign, an awareness campaign. And the way the Drug Enforcement Agency puts it is one pill can kill. Kids tend to think they're immortal, so we have some messaging challenges, but we got to work on how we communicate the threats that are out there. We have so many fronts we got to work on here. These social media platforms, by the way, make it as easy to order fentanyl as it is to order a pizza. And that's part of the problem we face. We don't have enough treatment, not even close. Now, we have Commissioner Buxton-Andrade here, who's led the region where the money's getting deployed to build more treatment capacity. That is a critical lever we've got to pull. How do we build more treatment capacity, recovery, education, and awareness? Because this crisis is as bad as it's ever been. That is, I guess, mostly true because as a formal matter, less people died from overdose and poisoning deaths in 2022 than 2021, a little bit less. But 2021 was the all-time high. And in 2021, more people died from drug overdoses, mostly were opioids, fentanyl, heroin, or the actual pills, than died in car crashes and gun violence deaths combined. And that's the way this world has flipped upside down. Because when I was growing up, car crashes is what parents worried about, particularly with alcohol. Then we had Mothers Against Drunk Driving. We took automobile safety seriously. We've really done a good job as a society lowering the likelihood that particularly young people die in automobile fatalities. What's happened in those couple generations? Well, we now have this fentanyl and opioid crisis, so that has become a top killer. And then I mentioned young people's mental health, suicide, mostly using firearms. People who try to take their life using other forms are less likely to succeed. But if you want to take your life with a firearm, it's very likely you'll succeed. Which is why how we use tools like a safe storage plan can make a big difference. I want to get to a third point about mental health, with I know a lot of folks here see, including our sheriff, is the intersection of mental health and the criminal justice system, which is to the extent we're not able to recognize people's mental health situations, they will often end up involved in the criminal justice system in different ways. And then to the extent they're in the criminal justice system and we don't end up helping them deal with their underlying mental health issues, we have this revolving door. And of course, it's kind of hard sometimes to separate mental health and substance abuse because they will often go hand in hand. In the San Luis Valley, I mentioned Alamosa earlier, Sheriff Robert Jackson says 90% of the people who are in his jail, they have an opioid use disorder. And so the challenge is, and I know we've got JC here from, is it now called Valley-Wide? Is that? He's working hard on how we do better on mental health for adults. One of the programs he's done has been, so I get this right, do you check on your neighbor like you check on your cattle? Call that a form of mental health first aid. Because part of the problem with mental health is people don't know how to talk about it. I often say, back to my cultural reference promise, the movie Terms of Endearment came out in 1980, and it had a character played by Deborah Winger who said, it's okay to talk about the cancer. I'm not afraid to say to people, I've got cancer, cancer sucks. 1980, by the way, cancer was a stigma. People were afraid to say they had cancer. They were embarrassed. Today, people say cancer sucks, but they won't say that about mental health challenges. They will suffer in silence, and when people die by suicide or of a drug overdose, families will feel ashamed and will often try to shift the conversation, gloss over, as opposed to say what I was privileged to be at a recent memorial service for someone who died by suicide, that she struggled with her mental health. And that we as a society have to recognize that mental health care is health care. And that when someone has a condition, we have to find ways to treat it, to recognize it. That is something that is true across our society, and so I'll end back on law enforcement. And in your sheriff here, you've got one of the top champions in Colorado on this point. When you're in a world and you suffer trauma, it doesn't go away. And there's a great book called The Body Keeps the Score, which talks about trauma stays in your body even when you're not even consciously aware of it. So I talked to one police officer who said she would drive out of her way 15 minutes every time to avoid driving in an area where she had a traumatic incident, and she didn't even realize she was doing it. And so if we can create more emotional awareness and support officers, we will create more effective policing and law enforcement. They'll both interact, by the way, better with people who struggle with mental health. So for example, and I know this is a pipe dream in some more rural communities, but the more you get officers really well trained around mental health, or maybe you find a way to get a co-responder, so it's just a behavioral health professional with an officer, you're less likely to use force because you won't escalate a situation, and we're trying to support that training. The more officers know about their own emotional awareness, the better they'll be. So one of the more painful stories is, police chief says to me, we looked at our worst officer-involved shooting, and it was someone who showed up at a child abuse situation that was incredibly traumatic and the person was badly beaten, went right to another situation. And the challenge in that sort of quick move is your body has not recovered, you're still traumatized, you're not at your best. And in that next situation, he used excessive force. He's no longer an officer. We disserve that officer. We've got a training program that hopefully you'll get to do, Sheriff, called Active Bystander Law Enforcement, which develops the awareness about how your other officers are doing, so you can check in with them. And if you see someone who's in a tough situation, be able to say, hey, we need to sit this one out. You are fortunate in this community. Your DA is here with us as well. You have incredible law enforcement leadership. You have mental health leadership. And what I got to say is this is hard, important work, and we as a society have a lot of it to keep doing. So I hope that generates some thoughts, ideas, suggestions. I'd really love to hear from you all and continue the conversation. Thank you. And I'm not afraid to call people either.
Okay, you all, now, if you want to come up, talk, you got to come.
You gotta come up. So I'm not afraid of calling people. He loves to call on people. So he knows everybody here.
Get your butt up here, JC. No.
JC is on the hook for being called up, as your DA and your sheriff and whoever else.
Let me see,
Please.
Let me make my list.
I said I'd better get up here before Rick called me.
Please, I know Rick knows you are, but introduce yourself because I may not.
I'm Donna Rowe, and I'm the director for the Department of Human Services here in Otero County. And so just another couple of comments to add to the plate that's already overflowing. Our youth that are in our foster care systems, and again, the relationship with our law enforcement and the detention stress beds versus the long-term care or the facility beds that are not available anymore for our youth. And the community resources are just not available. They are in some parts of the state, but I don't believe that they're adequate in any parts of the state. So whatever you can do to help support be able to develop resources. So None of us want our kids in detention. None of us want our kids in the hospital when they don't need to be. None of us want our kids sleeping with the department, in our visitation rooms. And so whatever we can do to support that would be fantastic. And then we also, our LGBTQ kids have another layer of stigma. Unfortunately, particularly sometimes in our rural areas, it's just tougher. So I don't have any answers, but a little bit more to add to the plate.
I also brought with me Virginia Carino, who's right here. You guys need to connect on this. We're thinking about a range of these issues and how we bring them forward. I appreciate that point very much. The question for our society, if we had like optimal planning, is are we doing enough with our kids' behavioral health, knowing that if you make the right investments and choices earlier, it's going to have this huge difference across their lifetime. What type of lives do they live? So I am very keen not just to hear the concerns, but if you have ideas, suggestions, or if any of you know, hey, this part of the state is doing this and it's really working well, I'm all ears. All right, Sheriff, we need your help here. Don't be shy. Come on up. Sheriff Mobley, for those who know, is on the Peace Officer Standards and Training Board, and the idea of training law enforcement around mental health, their own mental health, interactive mental health, is still relatively new. You've really been a leader. What makes you so passionate on this topic?
Well, there are a couple different things, actually. So, number one is the American Sheriff is the number one provider of mental health services in the country. This is the way it is. County jails have become the modern asylums. And so trying to address those issues, because often those that are experiencing crisis in our communities end up in our jails. Not only could they be involved in some criminal activity, but often it's as a respite to give local police departments, to give families a break from this person. They can't deal with this person anymore, so they end up in handcuffs. And they end up in my jail. And what happens is there may be an order for competency. Now they're going to be held in my jail, where any other person in the country would be eligible to post a bond. They're going to be held in my jail for up to 18 months with no charges. They cannot leave until they are given this competency evaluation. And so I have kind of an issue with that. And so in my next career, ultimately, that's, excuse me, kind of where I'm working, is how can I continue to help both the criminal justice system and our Colorado sheriffs in kind of addressing that issue. So on the street level, we're also dealing with some things. So for a while, we mandated, I was one of the agencies that mandated what we call CIT training. And some phenomenal training, kind of focused on de-escalation, but also kind of the mental health picture. But what we're seeing is we're starting to get away from that model, trying to keep people out of the criminal justice system. We're seeing the opposite. We don't know what else to do with them, so we don't have any other place to put them here locally, just because we lack funding and resources and so forth. And so they end up in the jail, and as A.G. Weiser had mentioned, it becomes this vicious circle, this cycle that keeps on going. And there are people that I've seen go through this, anywhere from 4 months to 18 months waiting on an evaluation. I've seen it 3, 4, 5 times, 6 times in my career, the same person. So again, they're not getting any better being held in a cage. Now that I've closed my jail, I've been sending everybody to Bent County. For the last 2 months my jail was open. It was literally an asylum. All the critically mentally ill people in my county and Bent County were held in my facility. And it was challenging, not just for my staff, because we're not adequately trained for that. We're working on getting there, but that takes time. It takes money, it takes staff. So that's also another issue with criminal justice and with law enforcement, trying to keep our staffing up, trying to keep our people trained. So our agency, we're kind of thinking out of the box this year, thanks to some funding from the state on improving our skills and abilities as far as dealing with mental health goes, diversity issues, and some things like that, reaching out to an organization from California to come into our agency and train all of our staff. How can we do better with what we have? Because again, not just locally, at the county level or the state level, we're lacking a lot of this funding and these resources. So I'm just trying to capitalize on that because it is important. Because everybody we see that end up in my jail like this, they're somebody's brother, sister, son, daughter, mother, father. But it's just tragic to see them almost literally rot inside of an iron box because we can't keep them safe in our general population in the jail, and we can't keep them safe in our communities. So addressing that is kind of where I'm coming from and why I'm drifting the way I am into my next career.
It's one of the hard things that because we have to have a jail, but we don't have to have mental health care treatment, we end up funding the first and not the latter. There is a effort underway. I mentioned the opioid settlement funds that will build more capacity. Commissioner, would you be willing to just give people a quick update? I know you've been working really hard on that, literally chairing this region's effort. Anything people should know on that front?
I'm Wendy Buxton Andrade from Prowers County, and I'm the regional chair for Region 19, which covers 9 counties, which is Prowers, Bent, Baca, Kiowa, Otero, Las Animas, Huerfano, and Pueblo. We are in the midst of releasing the last harm reduction for our first year. We are having a challenge. If you want to educate yourself on harm reduction, it is reducing harm to the community on the opioids and substance misuse. And a lot of people don't understand that. It is not getting people clean, it is actually getting people so that they're in a state of mind to get services. So those are some of we've done education and prevention. That was released, just so you know, we had 2.7 million coming out to our communities. And so a lot of our schools, we've also had a harm reduction place get education and prevention and do summer camps for kids. We've done release in juvenile justice, and I'm kind of off here, so I don't remember all of the different things that have happened. But we're trying to get the money out there so we can get services bumped up that our communities needed. We're definitely, I mean, as Sheriff Mobley said, we're down. People that deal, and JC could probably speak about this too, in mental health. I mean, we do not have enough people to offer substance use, treatment and mental health because they go hand in hand with each other. So yeah, we put out, we're getting ready for the next RFP. If you guys have any questions about the RFPs coming out, we'll do year 2 here in September. We'll release the second RFPs. We're going to release them probably in little bits. And if you've got schools that want to do stuff, please have them contact us because we really want to get it into prevention and education. We did release 30% of ours into prevention and education because we want to have it, this money in the hands to prevent, but also help the people that are needing the help so there's no wrong door for them. That's kind of way we've gone in this region. So
No, thank you so much, Commissioner. The backstory is $720 million in counting coming to Colorado because our office sued these companies like Purdue Pharma. In fact, Wendy and JC were up there when we announced that we were suing the Sackler family individually, and that's part of the recovery. We're also recovering funds from Johnson & Johnson and a whole bunch of pharmacies and a bunch of the distributors. And 90% of that money is all going to the local and regional level. The state funds include some innovation grants, which we look forward to getting from this region as well. That's something that, again, encourage you to work on. So, District Attorney, you want to go next, or should I have JC? You go, and JC, you're next afterwards. Come on, Will. And thanks for making time to be here. Appreciate it.
First of all, Phil, thanks for coming out. Really appreciate your office and all they do. There's not a week goes by that our office, the DA's office, doesn't interact with Phil's office. He's got a great staff that helps us out with the pellet issues, legal research issues. It's a great staff, and he's really doing a great job. So thanks for coming out. One of the issues continuing, maybe backing up what Sheriff Mobley had said, it was probably surprising to a lot of folks to hear that he's running an asylum in his jail. Let me tell you why that is. People who are arrested who have a criminal case and who also are perhaps not competent to proceed, we don't prosecute people who are not competent to proceed to trial. So what happens is they must have an evaluation done to see whether they're competent to proceed to trial. This evaluation takes anywhere from 3 to 6 months to happen. That's just the evaluation. That person sits in jail. After that evaluation happens, the person must then be restored to competency if they're found incompetent to proceed. If they must do that inpatient, there's such an intense backlog at the Colorado Mental Health Institutes and Pueblo and other facilities. The backlog is so intense that those people will sit for another 12 to 18 months.
If I could just give you the backstory. The reason is, like law enforcement, the mental health, behavioral health capacity on the staffing side is in dire straits. So there's literally a wing or more in our state mental health hospital that is not being used because they don't have the staff.
So we can't get those folks restored to competency so that their cases can then be adjudicated. So that's the reason why, and that's a big problem in our communities, and we don't see the drug problem, I think, contributes a lot to what we're seeing. So I don't know if there are solutions, but I would tell you that our district court has started a specialty court to deal with the many people who are incompetent to proceed and who are in need of services, to see if we can find those services within the community. So we've started a competency court, a specialty court, like a drug court, if you've heard of that, or a veterans court. We're doing that just for a competency court to see if we can work that out. And a lot of those models are coming from the state and other larger jurisdictions. So I think we're the only small jurisdiction that's doing that.
I had not heard about that. That's great. Virginia's going to hear more about that. Will, if you can make sure to connect with Virginia.
So anyway, thanks for coming down.
No, real pleasure. Thank you.
It's a big issue in our community. I appreciate you putting the light on it. Thank you.
Thank you. All right, JCU names we mentioned enough. We'd love to hear, like I said, about mental health first. Mental health first aid, the work you're doing in Ordway with the school, other efforts. You've been a real innovator. These are challenging times, but they call for innovation to respond.
Thank you. J.C. Carica, Valley-Wide Health Systems. Previously, we were Southeast Health Group, Southeast Mental Health. I agree with everything that's been said so far. I also serve on the National Council for Mental Well-Being, serving the 7 states out here. And one of the statistics that caught me when I was out there 6 weeks ago was that by 2030, we can anticipate being short 30,000 counselors in the United States. The trending is not in our favor. And so what does that mean? It means we can't continue to just lean on licensed providers to try to fix this problem or even stabilize it, because the workforce isn't there. What we need to start doing is defining that level of care, and those people who are most vulnerable and maybe in a crisis state, get those to those level of providers, because there's not enough of them, and build a different workforce and think about treatment in a different way. And so some of the things I'm starting to suggest as I travel is building safe spaces in communities. It doesn't require a certain credential to create a safe space. It requires a certain personality. And we're starting to see these spaces pop up. We have the Coffee Break Project in Rocky Ford. Last week alone, we had 50 visitors. None of these are clients. These are people in the community that just come in and want to connect. I had a person catch me in the street at the Swig store Tuesday morning, had never been there. Said I was having a rough day. I needed a place to go. Somebody said I could get free coffee and a donut. I went there. I stayed an hour and a half. And when I left, it didn't fix my problem, but I knew I could get through the day. And now I have a place I know I can go. Our peer houses, we're trying to put peer communities or peer houses every 30 minutes or 30 miles through our catchment area. Again, how do we draw on people with recovery experience? How do we draw people in that just have a passion to create safe conversation and safe space? That doesn't mean they're counselors. They're not providing that level of care. But we create safe environments. In those safe environments, then we can screen them. and see if they're deteriorating or they're more complex patients, or could be, or have more complex issues, we can then refer them to a higher level of care. But we can't continue just to throw all of the behavioral health issues at counselors and expect them to fix it. There's just too much need, there's too much complexity, and I think we need counselors to work at their type of their license because of the shortage we have. So we can train gatekeepers to be more involved in their communities and create these safe spaces. So for example, and I'll end with this, AG, we have a program that comes out of the University of Colorado called COMET, Changing Our Mental Emotional Trajectory. We've trained in the last 2 years 150 people in Southeast Colorado. It's basically just a conversation starter to check on people. People that you run into at the post office, at the C-store, the feed store, the lumber yard, church, whatever it is. And it's just a gentle conversation to check on people. Well, those 150 people have been trained. Let's conservatively say that we encounter in our personal lives 50 different people in a week through whatever we do. That's 7,500 encounters in 1 week. There's only 49,000 people in Southeast Colorado. So in theory, in 1 week, we can check on 1 out of every 7 people in our 6-county region. All of a sudden, those gatekeepers are the ones having the conversations, checking on people, encouraging them. Are you going back to church? Have you talked to your mother? You know, when's the last time you went to card club? Do you need to see a therapist? Do you need crisis? We got to create a different narrative on how to get ahead of this, because just by expecting more of this next generation to be healthcare providers, it's not happening. Nursing's got a shortage, docs have got a shortage, behavioral health's got a shortage. We've got to rely on our community members to become gatekeepers and the eyes to help screen our communities.
I love everything you said, although I'd probably change the word gatekeeper to something else.
Okay.
I don't know what the right analogy is, but it feels like it's more empowering and positive, where gatekeeping feels like something. So I'll thank you. I have suggestions for JC in that, but I thought that was
blow up my email if you got
amazing. And I want to underline something you said, because I think it's worth saying. Part of what's happening, I think, right now, you mentioned people in a church, is we have a connection crisis in this country. So the Surgeon General called it actually an epidemic of loneliness. 30 years ago, Robert Putnam, I mentioned one great book called The Body Keeps the Score. Another one is called Bowling Alone. And he said in the 90s versus the 50s, people were in bowling clubs, but more apt to be bowling alone, not in groups. People are less apt to be a member of a church, less apt to be a member of a sewing club, less apt to be a member of a card playing club. The less connection people have, the less people are feeling like they can check on each other, because a lot of those 50 interactions, people aren't connected. Hey, how are you doing? No, how are you really doing? Like, they're not having those conversations, where 40 years ago, there was more authentic connection. People were better mentally, health-wise. Now, people are on their devices feeling like inferior to other people, or disconnected, and or be getting fed dangerous content. So we have a different challenge today than we had in the past, and I think there's a lot of components. I'll add one more. I take it your school district 4 days a week, probably?
Most. Yes.
Most around here? What's that 5th day look like for kids?
They're
On their devices? So that's part of what we're up against. What if you had people in that 5th day going fishing together, or doing some, law enforcement training work, or doing some nursing apprenticeship work? That's a different type of, again, emotional development for kids than what they're getting on their devices.
The comment about connectedness is great, because if you look at when I grew up in the 70s, we ate a meal together as a family 5 days a week. In the 80s, it was probably 2 or 3 times a week, and we started going out to dinner and would sit down in a restaurant, right? In the 90s, it became fast food. 2000s, it became the drive-through, and because of COVID, it's delivered to us. We don't even leave our home. So just over the course of 5 decades, I've seen that connectedness totally change, where people deliver groceries to us, they bring food to us, we don't even have to go out. That doesn't help with the connectedness that we need to do to support our community members. So, thank you.
Thank you. Yes, please.
So to follow up what JC was saying, I'm Kelly Eddington, and I actually, I used to teach here, and then I was a counselor for quite a while. Now, some of you may not know this, I actually work for the Colorado School Safety Resource Center, which is under the Department of Public Safety. And I'll tell you a couple of different things. First of all, I'll tell you some of the things that we can offer to maybe help, like JC was talking about, getting some of that connectedness in the area to make those, not gatekeepers, but whatever we want to call them.
Connectors.
Connectors, there you go. So we actually, I live here in La Junta and I work out of my home, but I travel all over the state. And we actually meet up and train school districts. We train administrators and mental health teams for suicide risk assessment toolkits. We do physical and mental health. So we also do threat assessment toolkits. And also we do, I'm an assist trainer, so that is applied suicide intervention skills training. That's an excellent 2-day training for anybody. It doesn't have to be schools. It can be companies, it can be churches, it can be anybody. It's an excellent, excellent training that makes anybody in the community one of those connectors. And also QPR, we offer that as well. That's question, persuade, and refer. That's another suicide intervention training that it can be for anybody in the community as well. And that's an 1.5-hour training. It just gives you the basic skills to see what to look for and what to do if you do see somebody, or if you are told of somebody that is thinking about suicide. We also do other things for schools like bullying and different things like that. Youth mental health first aid, we can also train on that. So that's just a plug for the center, but also I'm not sure if this is what you're referring to in Alamosa, but you work with Safe to Tell, so Safe to Tell, or they work under you. So Nicole and Brett from Safe to Tell are actually my partners in this. We have a program that we have a grant that the center received, and we pulled in Safe to Tell to work with us to try to get this all around the state, and it's called Handle with Care. And Handle with Care is a program, if you haven't heard of it, that it's law enforcement working with school districts. And so what happens is if a law enforcement officer goes to a home and there is some kind of trauma in the home, and they see that there's children in the home, what they do is they send a message to, and with our grant, it's going through Safe to Tell. There are places all over the country that are doing this that don't have Safe to Tell, and there's places in Colorado that are actually using Handle with Care already that don't do it through Safe to Tell. But we're going to start with 3 pilot schools, and we are using Safe to Tell, and hopefully.
Is Alamosa one of those pilot schools?
No.
Because I think they're doing the same thing you're talking about, not even knowing the program exists.
Well, yeah, I think it's
Which
very
is great.
similar.
People don't have to wait till this gets delivered up to you. You guys can start doing that here.
Well, they already have.
Here it's already one of the pilots.
East Otero, they're not one of the pilots, but I talked to them before I knew we had pilots.
Yep.
And so East Otero School District has already begun the meetings. And I know the Sheriff's Department has already heard about it, the Police Department. And so they are going to start it without Safe to Tell, but what it is it's just law enforcement going to a home. If there's trauma in the home, they send a message, and a lot of people are just using a QR code or something where it automatically sends a message to the school district, to the, what we call gatekeepers, connectors, I guess. And so those connectors then send and all the message is the student's name and Handle with Care. They don't need to know that there was domestic violence in the home or anything else. They don't need to know that. So it's just sending a message saying Handle with Care, telling the school district that they need to just show some grace. If a student comes in and they don't have their homework done, keep them in from recess if it's a little one, or don't, fault them for that. Give them extra time and maybe meet with them one-on-one after if they need some one-on-one help. Or if they fall asleep in class, don't give them an F and slap their desk and get mad at them. You just send them to the nurse to get some more rest. So it's a great program, and then also it's tying in like outside mental health facilities, because then we encourage them to come into the school, and they may be the final step in that. But nobody knows anything. The student doesn't even know that the Handle with Care notice went out. So it's a great program. I think it is similar to what Alamosa is doing, and once we get those pilots, we're going to try to get it all over the state of Colorado.
Awesome, thank you.
I wanted to follow up.
Yeah, please.
One of the things that the opioid region is doing is a website, and we're going to have QR codes that we're going to, so people with trauma that are going through and looking for substance use treatment or anything, they can go on this QR code. Every one of the law enforcement, Sheriff Mobley is helping us get that out there. Hopefully our website will be up and running probably September, and so we can connect people that are in trauma in the middle of the night. Little Johnny needs some help. They can go on this QR code and find out everything in our 9-county region of where to get some help. So it'd be nice to be able to connect with that, and also put your resource and put a link to that on our website for the region.
You guys need to chat
So,
after, that's great.
But yeah, we're going to have every law enforcement. It's our vision to have every mental health facility, DHS, any place that people are going to be, and they can pick up these QR codes, and it gets the information easily accessible to them. So.
All right, I know we've got some other thoughts. Yes, please, come on.
Hello.
I like it.
Hello, I'm Andy Plummer. I'm the CEO of Arkansas Valley Regional Medical Center. Nice to meet you, Attorney General Weiser. Looking out on this room, I see a lot of people I've met in the last year. Hard to believe it's been a year. So, a lot of challenges, but a lot of successes, a lot of rewarding experiences serving as the CEO of Rural Critical Access Regional Medical Center. For many, almost the last year, we were the only OB program between here and Garden City, Kansas. Lamar finally got theirs reopened, and I'm glad. That community needs an OB program within an hour's drive of most of their population. We were glad to stand in there and help them out while we could, but we're glad that it's back open. Our biggest challenge is lack of adequate funding. We're 42% Colorado Medicaid. Colorado Medicaid only covers 40 to 45% of the cost to care for those patients. What business can be sustainable when 42% of your business is only covered 45% of the costs? Add in the chase payments, that helps some, but there's still a gap. So that's our biggest challenge. So I see Kristen Carpenter in the audience, and Kristen's helping me find grants. So we're not just complaining about it, we're also lobbying. And I spent a couple days up under the Gold Dome in Denver with my other 46 colleagues, CEOs of rural hospitals across the state. And we had a lot of successes legislation-wise. So we're seeking grant funding to make up that gap. But we really need the state legislature to step up and appropriate enough funds to cover at least the cost to care for the Medicaid patients in this state. And we see also every mental health patient comes through our ER at some point, usually in the worst state of their crisis. And our team does an awesome job, and we work together with all their agency colleagues at Valleywide and law enforcement and throughout the county and the cities. So it's a great team here, and a lot of support and teamwork. So I'm grateful for that. My wife and I love it here.
Where did you come from?
Surprise, Arizona. We still have a home down there. I have family down there. And I was most recently in Seattle as an interim CEO of a 160-bed hospital. We're a big national company. Talk about a nightmare. 50-bed ER with a line out the door, a 6-bed mental health unit embedded within it. It was always full. 160 beds, those were all full. I had a medical gas an oxygen system that was so old we couldn't find parts for it. We couldn't, the company and the system that owned us would not replace it. So I was glad to get out of there.
Well, we're glad to have you here. I'll say a few things about the funding. We fought to protect, and thankfully did, the Medicaid expansion. It'd be even worse if that hadn't. And we also worked with rural hospitals on a bill so that you could cooperate with one another to save costs, so that, again, the economics are a little less challenging than we know they are. So thank you
for the COPA bill.
No, happy to work with you on that.
And that's going to help all of the rural hospitals work together, where we were under threat of antitrust.
Their lawyers were scaring them, so we fixed it. Basically, they should be able to purchase goods through a buying consortium so they get a better deal. Just to give you one obvious example. Rick, who haven't we called on yet, Rick?
Well, I'm not sure, but, I'm going to do a blatant plug real fast for Andy, because, I've been dealing with Andy since he came, and he's done a great job. He's put this hospital financially stable. He's got his staff going great. He's trained them out and stuff, but he needs help. He talks about that. But what's one of the biggest problems? If you look at the stats of the people within Southeast Colorado, we're going to Pueblo Springs. Make this your first choice. Let's get our hospital back like it should be and what it was. And this man has done his part. We need to do our part. So every citizen out there, you look at Arkansas Valley Regional Medical Center before we go to Pueblo, okay? Let's start taking care of our own.
One gauge I use to judge whether we're having success there is we're getting a lot more compliments than complaints. So our quality scores have always been strong. We have great outcomes. And we're also getting surveying of our ER patients now to get facts out there that the patients are overall satisfied with their experience in the ER versus the negative naysayers that are got very loud voices out in the community. So I'm combating rumors with facts and data. And we always have room for improvement, and we know that. But we have a great team there, a lot of dedicated experience, long-term employees. And we're very fortunate to have such a wonderful medical center with so many talented, highly educated and trained and experienced healthcare providers. And I see the parking lot filling up more and more every day. And that's a great indicator. I know that sounds weird. I don't want anyone to have to be at the hospital, but if
better they're there than go to Pueblo.
Please come to Arkansas Valley Regional Medical Center. We're there 24/7. Thank you.
Okay, Rick Ward. Rick does the Bent and Otero County Veteran Services, and I think he'd be
I really appreciate Rick, because we haven't talked about veterans.
This guy's a veteran hero.
No, we've not talked about veterans, but if you read that book I mentioned, it starts with post-traumatic stress disorder, which up until relatively recently wasn't even recognized. So veterans came home traumatized, dealing with a lot of the after effects, and were told to suck it up. It's awful that they weren't given the support, and it's still awful that veterans aren't given the support they need.
Well, thank you, and thank you for coming down here. So like Rick said, I'm Rick Ward. I'm the Veteran Service Officer for Otero and Bent County. There's approximately 2,000 veterans in those two counties. The vast majority of them suffered trauma of some form or another, whether it's PTSD, military sexual trauma, and it doesn't have to be combat related. A lot of times it's non-combat related trauma, training accidents, assaults, and other things that occurred to them while they were in the service. Going with that, a lot of them have substance abuse issues. They're self-medicating. They don't want to go in, they don't want to admit they have a mental health issue, that they need professional care. So they self-medicate either through drugs or alcohol or both. We're Brad Rowe, I'm going to get him up here in a minute, talking about him, but Brad and I work closely together on trying to get veterans into the services to address their mental health concerns and, prevent suicide and those other things, incarceration. I've got veterans in prison and in the county jails right now that I'm working with.
And what's the veteran suicide rate compared to the average suicide rate?
We're higher than the average.
Yes.
I think it's 2x.
And I just sat through a meeting this afternoon at 1 o'clock, and Colorado has the highest veteran suicide rate in the country. Wow. But we also have some of the highest veterans population in the country. We have 6 active duty military installations in the country. El Paso County has a veteran population of over 100,000. So it's probably one of the highest veteran populations in the country. So we have a large veteran population. Going along with that, we have the highest suicide rate in the country, just under 10%. We also deal with homelessness. We don't like to think we have homeless veterans out here in the rural areas, but it's a reality. When I first took this job 4 years ago, I didn't realize it existed, but it does. And unfortunately, we do not have the resources here to quickly house those veterans, to find them emergency shelters or anything. So that's something we need to work on. You know, that's all hand in hand. You know, veterans with trauma, with mental health issues, drug and substance abuse issues, and homelessness. Those are the challenges.
And domestic violence.
And yeah, the domestic violence ties in with that too. You have somebody that's suffered trauma, they get angry, they lash out, they're high, they're drunk, and they get into an altercation. And then they end up visiting with one of Sheriff Mobley's deputies. And it's a vicious cycle.
Brad, do you want to come up?
Sure. I planned on listening today, not speaking, but yes, absolutely.
Yeah, you weren't going to get away with that.
My name is Brad Rowe. I work for Valleywide, specifically under the Staff Sergeant Fox Suicide Prevention Grant Program. So it started about a year ago. I'm about 4 months in. It is brand new to me, the mental health world, behavioral health world. I've worked in construction, and obviously I'm a Navy veteran. It is a bigger problem than I thought it was when I got this job. What I try to do is I'm trying to work upstream, because when a veteran decides he's going to commit suicide, you've got about 10 minutes. And in 10 minutes, I can't help him. I don't have enough time. He's probably 40 miles away from me. So if I work upstream, help with the homeless, food, money, these are the issues that the veterans are facing. And, you know, I'm not here to complain about the VA. They do a very important job, but it needs to get better. It's a top-heavy institution, organization, government institution, and I know that Mr. Kilmer is working real hard, but it needs to trickle down into the areas like the Lower Arkansas Valley, where we do not have enough resources. We do not have any place that I can put a homeless veteran at this point. They got to go to Pueblo, and then they can only stay there for 23 hours. They have to pack up and move out so they can clean the space, and then they can move back in. It's just not an option for my veterans from Los Alamos, Lamar. It's too far away. So any help we can get on that, absolutely, would love to hear that. Thank you.
Thank you. Yes, please.
My name's Edward Bilo. I'm a city councilman, and I was in Vietnam back in the 60s. Too young to be there, but I was there. I can't tell you about what I did over there, but it was, I had PTSD when I came back. And I went to Fort Lyon, and most of the other veterans that I was with there were smoking pot. And I couldn't be any different. If it weren't for that pot, I wouldn't be here today. But I found out that having this connectivity, I like that word, that was my word too. You have to have good people out in the community to help you talk and make you feel valued. Because I'll tell you, when I came back from Vietnam, I was at SeaTac International Airport, and I got it was very traumatic. I got spit on, and I just couldn't believe the things that we were going through. But when I got back, I went to Fort Lyon, got some quick rehab, and the rehab was because Fort Lyon was open. Maybe we should consider reopening it without taking away the current Southeast resources that we have. But this is all pretty difficult for me to talk to. But I think what I'm seeing, I had good support when I went to OJC later on, and I had good support in the other organizations that I was in. Connectivity with everything in the community really counts a lot. Because today, what do you see? Nothing wrong with this, but women have taken over Rotary Club. I remember Rotary Club when I graduated. It was all men. And now it's all women, which I'm very happy about. Otherwise, Rotary Club would have disappeared. But you know, your Lions Club, your Kiwanis Club, and all these other civic organizations, they should be well attended, and they never should have died. But these veterans that come back and these people that have mental health problems, they should very much get into a community service organization. Because the connectivity, the interaction you have with people makes you feel valued. It did for me, because I got into everything growing up after I had all my good friends and good teachers at the college. They did wonders just talking. And I used to work at NIDCO, and some of the old guys there, World War II vets, they helped me through it too. That was connectivity that we had. So we got to look at, for the mental health people, going back and making a connection with your faith. I don't care what church you go to. If you don't like it, you can go form your own church and get a bunch of people to go there. Because back then, in my day, there was a few people. I mean, there was only few churches that you could go to. But now you got a whole millennia full of teachers, of churches that you can connect with, and people stay dedicated to them. There's nothing wrong with some of that going on too. So I really believe that these organizations going through recruitment, because I know I'm still in some of them, and it's hard to get people to really get in there and get active, because you got STP, same two people doing the same work, a whole group. And it shouldn't be that way. It should be dedicated. I always used to look forward to, I think it was Kiwanis Club that used to do the pancake breakfast in the morning. Maybe in some other committee cities they do it, but get connected. Good thing, and open up Fort Lyon again.
Well, I found this to be a wonderful conversation. There will be a new conversation starting at 5 on the rural and agricultural economy and the issues faced in this region. If any of you want to stay, obviously there are people who have interest deeply in both. Others who want to stay connected, you've heard from some of the great leaders in this community, and Diana and Virginia on my team want to work with you and support you. We have a lot of important work to do. I really want to thank you all for coming here, and thank you again to our mayor and Rick for hosting us. Thank you, everybody.
Attorney General Phil Weiser and the people of Southeast
Okay, everybody,
Colorado.
just heard that.